Small lifestyle changes that could have a big impact on your health. Joining us tonight to talk about your health is Dr. Shana Ntiri, Medical Director of the University of Maryland Greenebaum Comprehensive Cancer Center Baltimore City Cancer Program and Associate Professor at the University of Maryland School of Medicine. Doctor, great to have you back on the program. Let's start with the big picture. This is Cancer Prevention Awareness Month. And cancer deaths, we have some good news there, but some bad news on the number of people, particularly younger people, being diagnosed with various forms of cancer. What are the big trends taking place?
Yeah, that's correct, Jeff. So good to be here with you. Thank you for that introduction. Yeah, we're seeing that there are increases. I think if you look overall at the trends in cancer, we're seeing a decline. But there are specific populations that if you look at, including younger adults and women, that we're seeing increases overall. And a number of reasons for those increases has to do with our lifestyle, the fact that we are not eating as well as we could, we are more sedentary, not as active as we could, and then other habits, thinking about things that people often think about with relation to cancer, such as smoking and alcohol use. So all of those things are affecting the fact that we're seeing cancer more and more in younger adults.
Let's go right to a list of cancer avoidance ideas that you sent over. And tobacco is the top of the list. And certainly it's logical to understand how it affects the lungs, but it affects a whole bunch of things.
Yeah, it infects the entire body and can put you at increased risk for cancers that are not as obvious. I think when people think about lung cancer, they say, oh, yeah, I get if I smoke, that can lead to lung cancer, but it can be associated with other cancers, cancers of the mouth, thinking about things like breast cancer as well. And it's just not good for your body overall. So tobacco is definitely top of the list. If you are a smoker or use any other tobacco products, certainly encourage you to come up with a plan with your physician and your support system to help you to stop.
Number 2 on the list, I believe, is maintaining a healthy weight. Actually, let's run through the rest of this, and then we'll come back to a couple of the items. And related to that, watch what you're eating, and I'll let you pick it up from there.
Yep, healthy diet, being physically active. See what else you have there. Using sunscreen, which is something that people don't always think about outside of the sunny seasons. Not all individuals think about that. And then vaccination. HPV vaccine is a great example of prevention of cancer, right? If we are using the HPV vaccine, so HPV stands for human papillomavirus. It's associated most commonly with cervical cancer. And so now we're encouraging our elementary school age, our older elementary school age children, so thinking the ages of 9 to 11, to get this vaccination, but can be given through adulthood, through later adulthood. I think maintaining a healthy weight, oftentimes people have kind of their goal weight that they want to reach. We don't discourage people from getting to their goal weight, but even small decreases in your weight. So as little as a 5% weight loss, which for a lot of people could be 10 to 15 pounds, can improve your health significantly and also decrease your risk of developing cancer. Staying physically active, again, that is a good thing. Helps you to maintain that healthy weight, but helps your body to keep itself going. And so I think we have had this conversation before. We're slightly outside of the window of people and their New Year's resolutions, but this is the time really we want to kind of dig deep and hold on to those things. And the things that we know to do, the things that keep you overall healthy, are great ways to prevent cancer as well.
And especially the simple stuff. I'll come back to the HPV vaccine because it potentially makes for some awkward parent-child conversations, but the thing has been a spectacular success.
Yes, absolutely. It has really helped us to see declines in the rates of cervical cancer and also some of our oral pharyngeal or mouth or oral cancers. Really effective. You're right. I've got 11-year-old twins, and so who are getting ready to do their puberty lessons or their puberty curriculum in school. So those can be some awkward conversations, but important conversations. And I think for parents who might say, I'm not sure ready to have that conversation, you just talk about the fact that this is a vaccine that can help you to prevent cancer as you get older and to help you to improve your health, which is what vaccines do overall.
Let's talk about alcohol for a minute. There was a Surgeon General report linking alcohol to at least 7 types of cancer. So that's reading that, I'm never going to have a beer again, but I'm probably going to have a beer again. How do you advise people that you see in your practice to deal with information like that?
Yeah, it's important information. I think the first key is making sure that people are aware, right? That's the first step, is making sure that people have the information that they need in order to make informed decisions. And so when it comes to things like alcohol, there are many who abstain entirely from alcohol. If that's what they choose to do, certainly full-heartedly support that decision. For others who may choose to use alcohol, it's about using alcohol in moderation, and knowing, again, like you said, alcohol is linked to as many as 7 cancers, and cancers that people may not think about, but commonly liver cancer, even breast cancer again, and then our oral cancers. So if an individual drinks alcohol, can come up with a plan and say, let's talk about how you can decrease the amount that you're drinking. I think when I'm talking to patients in the exam room, it's always about meeting people where they are, right? I can tell them what I want them to do as their physician, but if I'm just telling them and not meeting them where they are, that's not necessarily a plan that's going to work.
Let's
But
spend a
again,
minute.
even decreasing what you're doing is enough. You don't have to. You don't have to quit, and it's okay to have a beer on occasion.
Thank you very much. I'm going to write that down. Let's talk about screenings a little bit, and I'll ask your thoughts on something we hadn't planned to talk about, and that is full body screening. So if you think about mammograms, the risk reward there is you're getting a little bit of radiation, but with the upside of catching a very common cancer, hopefully really early when it's more treatable. But
Yes.
if you ask doctors about full body scans, which it seems like I'm seeing fewer ads for. But anyway, that's the idea of like radiating everything just to see if there's anything going on. Most people who wear white coats think that's a bad idea. What's the difference?
Yeah, I think most people who wear white coats are going to think it's a bad idea. With any of these screenings, we're always wanting to weigh what are the benefits, like you said, versus the risk. What are the potential harms that come? So you spoke to the fact that radiation exposure is one. I think that's certainly a significant risk. The other thing is incidental findings, meaning that you will find things that aren't going to lead to any negative outcome, but can certainly cause a great deal of anxiety. And that's very real. Even with the screenings that we do, such as mammograms, colonoscopies, we do lung CTs for individuals who smoke, cervical cancer screening. All of these cancer screenings, they should always start with a conversation between the physician and the patient, understanding what the pros and the cons are, why you may want to, why you may not to, why you may not want to, why you may want to start at a certain age versus stopping at a certain age. We call this shared decision making. And I think that's really important because you never want to start down a path that's going to create anxiety for a patient that the patient doesn't want to deal with, or that the patient says, I'm not going to follow through on. So when you think about a whole body scan, right, you're looking at the entirety of the body. The likelihood that you will find information that is not going to have any medically significant utility that's going to create a lot of anxiety is quite significant. And so that's a major reason, too, that you don't see a lot of emphasis on whole body scans.
What are the conversations like in your practice? Is there a screening test that you really are good at talking people into, or presenting the case that they should get whatever this test is? And are there some that you and your colleagues really have a hard time getting people to sign up for?
Yeah, I think that varies. I can think of specific patients that I've asked to do cancer screenings, and it's taken years for them to get it done. I think one of the beautiful things about being a family physician is you have the longevity of a relationship. And so if I see you today and you say no, that doesn't mean it's no tomorrow or in a month or even a year from now. So again, really meeting folks where they are in terms of what their cancer priorities are. If we step it back in general and look at where cancer screenings are, I think there's always room for improvement. There is no cancer screening where we're saying, hey, we're hitting that out of the ballpark and we're doing exactly what we need to do. But there are certain cancers that we do better with. So thinking about mammograms, we tend to do better there. Thinking about colonoscopies, relatively speaking, we do better there. Thinking about cervical cancer screening as well. Other cancers, the one cancer that we know certainly there's a lot of room for improvement is lung cancer screening. And so that's for individuals who have a history of smoking and have smoked within the past 15 years. There are some other factors that we look at. But we know in the state of Maryland, for example, mammography rates are closer to 80% overall. Depends on what population you look at. Obviously, there are differences if an individual is insured versus uninsured, race, different things that can factor into that. But we'll say between 70-80% overall for the state, versus with lung cancer screening, where lung cancer screening rates are less than 10%. And so I think as a profession, there certainly is a lot of emphasis. It's something that we're doing at the University of Maryland, the Greenebaum Comprehensive Cancer Center, really looking at what can we do statewide to improve our lung cancer screening rates and to improve all of our cancer screening rates overall. I think we've also talked about the fact that COVID had a negative impact on cancer screening overall. We're beyond that, but we really have to make sure that we catch up with those individuals who may have stopped screening due to the pandemic and make sure we get everyone back on task and continuing to do those screenings moving forward.
Black Americans about twice as likely to die from a number of common cancers, prostate, stomach, uterine cancers. Talk about those disparities and what you and your colleagues are doing to try to address them.
Sure. Those are important disparities again. And I think they are for a number of reasons. If you look at what the rates are in terms of diagnosis versus the rates in terms of mortality, there tends to be a difference. So even though Black or African American individuals may not be diagnosed with these cancers more commonly, they are more likely to die from these cancers. And so that's a number of factors. We talk about the social determinants of health, thinking about access to healthcare, thinking about insurance status, thinking about equity in terms of the treatment that's offered, clinical trials, surgery, the time at which treatments are offered. There are a lot of issues there. What do? We try to encourage folks. I think it's one of the biggest parts of what I do on the day-to-day is to make sure that patients that look like me are, again, aware of what the recommendations are for them to get cancer screening and that they're following through on the recommendations. And that if they have fears or barriers or reason that they don't want to get them done, that we talk about those and try to address those. I also, you mentioned in my introduction, serve as the medical director for something called the Baltimore City Cancer Program, which is a community-based initiative of the Greenebaum Comprehensive Cancer Center. And that program specifically targets individuals who are either uninsured or underinsured, and so may have problems accessing things such as cancer screenings. And so we have an awesome team of outreach workers who go out into the community to make sure that people have the information that they need to enroll them into our program so that they can have access to cancer screening services that they may not otherwise have. And so there are a lot of initiatives like that out in the community to make sure people know you can indeed get these cancer screenings done. And if you have a question or you have a fear, that's okay. Let's have a conversation.
Dr. Shana Ntiri at the University of Maryland Medical Center. Doctor, we appreciate your time. Thank you.
Thank you so much.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.